If you're over 60 and you soak chia seeds every day, this message could protect your health. Chia seeds are often called a superfood, rich in fiber, omega-3s, and minerals. But what most people don't realize is this. When chia seeds are soaked the wrong way, they can become dangerous for seniors. Not because chia seeds are bad, but because how you soak them matters more than you think. Today, we're going to reveal 5 critical mistakes many older adults make when soaking chia seeds. Mistakes that can lead to digestive blockage, choking risk, medication interference, dehydration, and nutrient imbalance. Stay with us until the end, because mistake number 5 is the one doctors warn seniors about most, and almost no one talks about it. What chia seeds actually do in the body. Before we talk about mistakes, let's understand what makes chia seeds unique. Chia seeds can absorb up to 10 to 12 times their weight in liquid. When soaked, they form a gel-like coating called mucilage. This gel slows digestion, expands in the stomach, thickens liquids, traps water and nutrients. For younger adults with strong digestion, this is usually fine. But for seniors, slower digestion, reduced saliva, weaker swallowing muscles, and common medications change the picture completely. That's why preparation matters. Why seniors are at risk. As we age, several things happen naturally. Swallowing reflex slows, esophagus becomes less flexible, stomach acid decreases, gut motility slows. Many people take daily medications. Now imagine adding a seed that rapidly expands into gel. If it's not prepared properly, that gel can expand too late inside the throat, sit heavily in the stomach, cause bloating, pain, or blockage, interfere with medication absorption. This doesn't happen overnight, but repeated mistakes can quietly damage digestion over time. Mistake number 1, soaking chia seeds for too little time. Why this is dangerous. One of the most common mistakes is soaking chia seeds for just a few minutes, or worse, sprinkling them into a drink and consuming immediately. Dry or partially soaked chia seeds can continue expanding after you swallow them. For seniors, this can increase the risk of choking, throat blockage, esophageal irritation. There have been medical case reports of swollen seeds becoming stuck in the esophagus, especially in older adults. What proper soaking actually means? Proper soaking means enough water, enough time, complete gel formation. Minimum safe soaking time, 30 minutes, absolute minimum. Ideally, 2 to 4 hours. Overnight soaking is safest. When fully soaked, the seeds should be surrounded by thick gel, have no dry center, flow smoothly when stirred. If you still see hard specks, they are not ready. Senior safe tip. For anyone over 60, always soak chia seeds overnight in the refrigerator. Cold soaking reduces bacterial growth and allows complete hydration. Mistake number 2, using too little water. This one causes blockage. The water ratio problem. Many people soak chia seeds in a small glass with very little water. This creates a dense gel mass instead of a smooth, drinkable mixture. In the stomach, that thick gel can slow digestion too much, cause fullness, pressure, or pain, lead to constipation instead of relief. Correct water to chia ratio. The safest ratio is 1 tablespoon to 1 full cup, 240 milliliters, of water. For seniors with sensitive digestion, 1 tablespoon to 1.5 cups water. Never soak chia seeds in half a glass, thick smoothies without extra liquid, yogurt alone. They must fully expand before entering the body. Warning sign. If your chia mixture looks like pudding, holds its shape, needs chewing, it's too thick for senior digestion. Mistake number 3, drinking chia water too fast. Why speed matters. Chia gel thickens liquids.
When seniors drink it too quickly, swallowing reflex can be overwhelmed. Gel can stick in the throat. Risk of coughing or aspiration increases. This is especially dangerous for people with acid reflux, history of choking, or neurological conditions. Safe way to consume. Instead of gulping, sip slowly. Take small mouthfuls. Pause between sips. Think of chia water as food, not a drink. Best time of day. The safest times for seniors, mid-morning, early afternoon. Avoid right before bed, when very dehydrated, immediately with medications.
Why this is a serious problem for seniors. Chia seeds are extremely high in soluble fiber. When soaked, that fiber turns into a thick gel that can slow stomach emptying, trap nutrients, bind to certain medications. For seniors who take blood pressure medicine, diabetes medication, thyroid pills, heart medication, pain relievers, this can reduce how much medicine your body actually absorbs. You may think your medication stopped working, when in reality it's being blocked. How fiber interferes with medicine. The chia gel acts like a sponge. Inside the stomach and intestines, it can stick to pills, delay absorption, reduce drug effectiveness. This is especially risky for time-release medications, blood sugar-lowering drugs, blood thinners. For seniors, even a small change in absorption can cause big effects. Safe timing rule for seniors. Doctors generally recommend take medications at least 1 to 2 hours before chia seeds, or 2 to 3 hours after consuming chia. Never swallow pills with chia water. Mix crushed pills into chia pudding. Real-world warning signs. If you notice blood pressure readings changing, blood sugar becoming unstable, medications not working like before, and you recently added chia seeds to your routine, this could be the reason. Mistake number 5. Using chia seeds every day without a break. Why daily use can become harmful. This is the mistake doctors warn seniors about the most. Chia seeds are extremely powerful. Used occasionally, they can support digestion. Used daily without limits, they can overload the gut with fiber, reduce mineral absorption, worsen constipation, increase dehydration risk. For older adults, moderation matters more than enthusiasm. Fiber overload in seniors. As we age, the gut becomes more sensitive, digestive enzymes decrease, hydration levels drop faster. Too much fiber can cause bloating, cramping, hard stools, feeling blocked. Ironically, something taken for digestion can cause digestive distress. Safe weekly use recommendation. For seniors, 2 to 4 times per week is enough. 1 tablespoon per serving. Always fully soaked. Daily use is not necessary to get the benefits. Dehydration risk often ignored. Chia seeds pull water into the gut. If you are not drinking enough fluids, stool becomes dry, constipation worsens, dizziness may increase. This is especially risky for seniors who drink little water, use diuretics, live in hot climates. Who should avoid chia seeds completely? Chia seeds are not for everyone. Seniors who should avoid or consult a doctor include those with swallowing difficulties, history of choking, esophageal narrowing, severe acid reflux, chronic bowel obstruction, certain digestive disorders. Health foods are not one size fits all. Warning signs your body is not tolerating chia seeds. Stop using chia seeds and consult a professional if you experience chest discomfort after swallowing, persistent bloating or pain, worsening constipation, feeling of food stuck in the throat, sudden medication changes. These are not signs of detox, they are warning signals.
The gold standard.
How seniors should prepare chia seeds. Step-by-step senior-safe preparation. If you are over 60 and decide to use chia seeds, follow this exact method. Step 1. Measure carefully. Use 1 level tablespoon only. Never estimate or pour freely. More is not better. Step 2. Use enough liquid. Minimum 1 full cup, 240 milliliters of liquid. Ideal for sensitive digestion, 1.5 cups. The liquid must fully surround the seeds. Step 3. Soak long enough. Minimum 2 hours. Ideal overnight 8 to 12 hours. Refrigerate while soaking to keep it fresh and safe. Step 4. Stir twice. Stir once after adding seeds. Stir again after 10 to 15 minutes. This prevents clumping, which can cause swallowing issues. How to tell when chia seeds are fully safe. Properly soaked chia seeds should be evenly suspended in gel, have no dry center, pour smoothly, look glossy, not brainy. If it looks chunky or pudding-like, add more liquid. Best liquids for seniors to soak chia seeds. Not all liquids are equal, especially for older digestion. Safest options. Plain water, best choice. Warm water for gentle digestion. Unsweetened almond milk. Diluted coconut water. These hydrate without thickening too much. Liquids seniors should avoid. Thick smoothies. Yogurt alone. Protein shakes. Juice with pulp. These create overly dense mixtures that can slow digestion and increase choking risk. When seniors should consume chia seeds. Timing matters just as much as preparation. Best times: mid-morning, early afternoon. At these times, digestion is more active, hydration is higher, medication schedules are usually clear. Worst times: avoid consuming chia seeds right before bed, late at night, when dehydrated, immediately after waking. These times increase discomfort and reflux risk. How much is actually safe after age 60? Forget internet trends. For seniors, the safe amount is 1 tablespoon per serving, no more than 4 times per week. You do not need daily use to benefit. Why less works better for seniors? Older bodies absorb nutrients more slowly, react more strongly to fiber, dehydrate faster. Small, spaced doses reduce stress on the gut. Common myths versus medical facts. Myth 1. More chia means more health. Fact. Too much fiber worsens digestion in seniors. Myth 2. Chia cleans the intestines. Fact. The body detoxifies itself through the liver and kidneys. Myth 3. Dry chia seeds are fine in smoothies. Fact. Dry seeds can expand later and cause discomfort or blockage. Myth 4. Everyone over 60 should eat chia seeds. Fact. Some seniors should avoid them completely. What to use instead of chia seeds? Safer options. For seniors who don't tolerate chia well, soaked oats, ground flaxseed, very small amounts, stewed fruits, cooked vegetables. Cooked soft foods are gentler on aging digestion. Part 4. Final safety checklist and doctor-style summary, approximately 2,000 to 2,200 words. This final part brings everything together in a clear, calm, and practical way, so seniors can make informed decisions without fear. Remember, chia seeds are not dangerous by nature. The danger comes from misuse. Quick recap: the 5 critical mistakes that can make soaked chia seeds unsafe for seniors. Wrong: not soaking long enough. Partially soaked seeds continue expanding after swallowing. Increases choking and throat irritation risk.
fix. Soak at least 2 hours, ideally overnight. Wrong. Using too little water. Creates thick, heavy gel. Can slow digestion and cause blockage. Fix. 1 tablespoon chia to at least 1 to 1.5 cups liquid. Wrong. Drinking too fast. Overwhelms swallowing reflex. Raises aspiration risk in seniors. Fix. Sip slowly. Treat chia water like food. Wrong. Taking chia seeds too close to medications. Fiber gel can trap or delay medication absorption. Fix. Separate chia and medicines by several hours. Wrong. Using chia seeds every day without breaks. Causes fiber overload. Increases dehydration and constipation risk. Fix. Limit to 2 to 4 times per week. The Senior Safety Checklist. Before using chia seeds, ask yourself, am I over 60? Do I take daily medication? Do I drink enough water? Do I have swallowing or reflux issues? If you answered yes to any of these, extra caution is required. Safe Use Checklist. Measure exactly 1 tablespoon. Use enough liquid. Soak overnight when possible. Stir well to avoid clumps. Consume slowly. Avoid daily use. Space away from medications. If any step feels uncomfortable, stop. When to stop using chia seeds completely. Stop using chia seeds and seek advice if you experience chest discomfort when swallowing, persistent bloating or abdominal pain, worsening constipation, sensation of food stuck in the throat, unexplained changes in medication effects. These are warning signs, not cleansing effects. Who benefits most and who does not? Seniors who may tolerate chia seeds well, those with good hydration habits, those without swallowing issues, those not on complex medication schedules. Seniors who should avoid or be very cautious: history of choking, esophageal narrowing, severe reflux, chronic bowel problems, multiple daily medications. Health choices must be individual. Doctor-style final message. If you are over 60, your digestive system deserves gentleness, not trends. Chia seeds can be a helpful food only when used correctly and sparingly. There is no need to force any food into your routine. Real health comes from balanced meals, adequate hydration, simple, well-cooked foods, and listening to your body. No superfood